Blackburn.
Hi, yeah. I understand that there's a bit of a push on it. Hasn't been approved yet, but how you feel about vaccination shots for those 5 to 11, especially given yesterday's modeling that shows that the cases among that age group are rising pretty significantly.
Well, I think that uh, if there is an approved vaccination, if I anticipate that vaccination for young people will be approved, and if that is the case, I think that'll be a positive step in the control of COVID-19 moving forward. So I remain optimistic that that will come to fruition.
Also, there's an online petition right now from one group, one company that represents a number of restaurants in the city asking for a loosening of restrictions. Their logic behind it is that if they're only allowing in fully vaccinated people, do they really need to shut down at midnight? Is there any wiggle room on that? And are you still having discussions with restaurants in the city?
Well, we evaluate the data on a regular basis, and we reevaluate, and will continue to evaluate and reevaluate public health direction. It's worth noting that before that public health direction was implemented, um, um, uh, that there were 44 restaurants that had exposures of COVID-19 that ultimately led to 67 cases. Since the restrictions have come forth, that number has been reduced to six restaurants and associated with 8 cases. So it's likely that the public health direction had some impact. The second thing to consider is that Windsor-Essex um, has been disproportionately affected by COVID-19 when compared to other health districts in the province. The epidemiologist has sent me some recent data, and he'll talk about it a bit more tomorrow. Is that on cases, on the case rate, Windsor-Essex is 4th in the province. The percentage of people who test positive when they get a test is 3rd in the province. As many people might remember, Windsor-Essex was in periods of a lockdown for a longer period of time than any other part of the province. And we know that 30% of the cases at the current time are coming from young people between 12 and I think 12 and 18. So we can clarify the exact numbers, but it would suggest to me that Windsor-Essex has been disproportionately affected by COVID-19 compared to other districts. As it relates to schools, we've had 104 classes of young people being dismissed or being excluded from school because of COVID exposures in this school year. In the previous school year, there were 50, that was for the entire school year last year, I believe that there were 50 dismissals. So we've already had more dismissals this year than we've had in all of last year in the academic year. There have been 17 school outbreaks this school year compared to 8 in the previous year. Whatever public health measures we have to put in place, we have to consider what is the local context, and the data would suggest, and the historical experience would suggest that Windsor-Essex is disproportionately affected by COVID-19. The other thing I think about is that whenever we make public health guidance or decisions, um, we recognize that there is a component of inconvenience to the community overall. But the fact of the matter is that no business, no family, no household, no school, no daycare center has been unaffected by COVID. Every single member of this community has been affected by COVID-19, and it's recognized that many of these public health measures have some component uh, of of inconvenience. The final item I'd like to share, and forgive me for being long-winded, is that we want to break the chain of transmission, because at the end of the day, one of our most important goals is to keep schools open for instruction. And in part, keeping schools open for instruction is to contain COVID in the broader community, to prevent COVID from entering schools, and if it does enter schools, to make sure that it is not disseminated widely among the school community. So I hope that provides some context, but and my apologies for being long-winded on this.
That's okay, but I do want to clarify. Are we having an update tomorrow or on Friday? Because I'm not sure. I thought there saw a note saying that you guys were shut down tomorrow.
That's correct. We
Oh,
are shut down tomorrow, and our epidemiological update will be posted on Friday to our website.
Okay, thank you.
Any questions from Windsor Star?
Yes, good morning, Nicole. Good morning, Doctor. Doctor, based on everything that you've just said, I may or may not know the answer to the question I'm about to ask, but October 1st is coming up, and that would be the day that you'd indicated you'd be reevaluating the decision to postpone extracurriculars. Have you made a decision yet on whether or not extracurricular activities in schools will be returning sooner rather than later?
right. So as it relates to, we are in constant dialogue with school board officials at the Public Health Service. And with regards to extracurricular activities, that was a recommendation to the school board based on school boards based on some level of dialogue. And we'll continue to have discussions with the school board. The key thing to think about is that broadly there are two levels of activities at schools. There's instruction and non-instructional activities. And if the priority is to maintain instruction, and I think that most of us would think that it's most important that young people get a chance to go to school and interact with their teachers and learn the underlying material and interact with their fellow students. So I think the focus would be to try to keep instructional activities at school going forward. Relaxation of overall of public health measures is in some way related to the vaccination rate as well. And I'm hopeful as the vaccination rates improve that we may be in even a better position to reevaluate extracurricular activities. At this point, we've not made any specific determination related to our recommendation, but we continue to evaluate the data and continue to have discussions with our school board colleagues.
Thank you.
Any questions from AM 800?
Doctor, I guess just your message to these bars, restaurants, pubs that are asking for I know they're calling it a curfew, but Dr. Ahmed wasn't calling it a curfew, but just in regards to the time frame, just your message to those establishments.
Well, I think the first thing I'd say is we recognize, I think that the Public Health Service and the community recognizes that these public health policies and measures are challenging for owners of these establishments. But I would also share with them that, like all of us, we have our professional lives and we have also our personal and family responsibilities. People who work and operate these establishments are also parents and husbands and wives and the children of perhaps children and also the children of others. And so we have responsibilities not only to our own immediate commercial establishment and our own professional lives, but we also have responsibilities to the other people in our life. The goal is ultimately to reduce the burden of COVID-19 on the community overall, and that's what we're all trying to work towards. I'm hopeful that as vaccination rates continue to improve, other public health measures are effectuated. That I'm hopeful that that public health measures, public health restrictions will ultimately be reduced, and so that's our hope. But we want to continue to work with all members of the community to try to bring COVID-19 under control. The other item, and this I think is worth emphasizing, is the Public Health Service is governed by primarily the Health Promotion and Protection Act. And that act was formulated by the legislature for exactly this purpose, for local health districts to try to formulate plans that respond to the local realities of public health. And that's why Ontario has these autonomous health districts. The other item I'd like to share is that the Public Health Service is apolitical. It is not an agency or organization that is by definition swayed by political priorities, and it's swayed by what the best evidence and data is at this point in time. And that is what the legislature put forth when it formulated this statute. In part, some of the revisions of the statute were formulated because of the experience with SARS. And so the local public health service is trying to work as best as it can to try to control COVID-19 in the community.
Nicole, I have a couple questions for you. In regards to schools, on the French Catholic School Board website, they have one school that has additional cases, and then obviously it's in French, but when I translated it, it says partial hatching for one of the schools in McGregor. By any chance, do you know what one partial hatching means?
I do not, but we do have a meeting this morning, and so I can. I haven't looked at the website or tried to translate it myself, but I'm not sure. It's not a term that we would use or from us, so I'm not sure what that means.
Okay, and then I asked this on Monday, but just any updates in regards to the blitz with the province?
Yeah, sorry, Rob, I was hopeful I would have a little more information today to share. I think what we can commit to do is, given that we don't have another media update, share some information on the blitz. We are working with our provincial partners, and so they're putting together sort of a summary for us. So we don't have it quite yet, but we can share it with the media as soon as we do.
Thank you.
Actually, as we speak, I just got some information. So I don't have exactly more to provide, but so we did have 218 visits collectively over the weekend, and 20 tickets were issued, as well as some orders amongst those visits. But I don't have the details exactly what the tickets were written for, so which part of the legislation they were written for. So we'll get more detailed information and share, and certainly we're interested in that, in particular as it relates to the implementation of the proof of vaccination program.
Appreciate it. Thank you.
Yeah.
Any questions from CTV?
Yes, good morning. Regarding the vaccination for 5 to 11-year-olds, are you developing plans similar to other Ontario Health units or teams where you would be able to hit the ground running if an announcement is made?
Yeah, go ahead.
No, Nicole, I was going to say, perhaps you could respond to that operational item.
Yeah, so we are working internally as well. All health units collectively, across the province are working in coordination with the ministry to be prepared for additional announcements related to vaccinations, certainly for the ages of 5 to 11. We don't have an exact target date per se, so it's a little bit more difficult, but we are working on our plans, and we'll be working with our hospital partners and primary care partners as well as pharmacies on those plans in the coming weeks.
Okay, thank you.
Yeah, if I could supplement that as well, I think that as we move forward in the pandemic, it's particularly important that that we continue to reach out to our family practice colleagues. Family practice is a cornerstone of community medicine, and I'm hopeful that we'll have a multimodal channel of distribution. And as it relates to young people, it's particularly important that our colleagues in family practice and general practice are able to be included in the distribution plan for vaccination. Also, I anticipate that the vaccine will probably be available hopefully later this year, but it's particularly important to get young people who are eligible for the vaccine vaccinated quickly. After one gets the first dose of vaccine, there's a period of time before the vaccine has effect, and then one has to get the second dose of vaccine, and then a period of times for the vaccine to hit optimal effect. So it's particularly important once the vaccine is available, which I anticipate that it will be, that we roll out an effective community-wide program to effectuate vaccination of young people.
Okay, thank you. And do you know how many kids are in that age group in Windsor-Essex, approximately?
Nicole, do you have an estimate, or we could probably find that number for you?
Yeah, I wouldn't want to speculate on the exact number, but we can get the exact number for you, or an estimate at least.
Okay, sure, no problem. Thank you.
Any questions from CBC?
Yes, good morning. The active case count is now almost half of what it was when those additional restrictions for bars were implemented. Now, I appreciate that case counts aren't the only factor that you look at when making these kinds of decisions, but is there some kind of threshold for when you would consider lifting those additional restrictions?
Well, we continue to evaluate the data on a regular basis, and we try to make the best decisions we can. Case counts, in fact, are not the only measure of burden of disease. So burden of disease includes case counts, the number of deaths, and my colleague Ramsey can share this, but I think there were 2 deaths this past weekend and 3 deaths during this work week. Nicole, if you can just clarify that. But we continue to look at the other burdens of disease, which include case counts, deaths, the number of people being self-isolated, the number of cohorts of people being dismissed at schools, the number of outbreaks. So there are some data elements that suggest the burden of disease might be less, and then there are other data elements that suggest the burden of disease might be greater. So just looking at the data that was sent to me, there have been 104 classes of young people that have been excluded from schools. Last year there were 50. So if this is my correct understanding of the data, there are more cohorts being dismissed in this academic year than were dismissed in the entire academic year last year. There are 17 school outbreaks in this academic year. There were 8 last year. So I think that we have to look at the epidemiological data in a wholesome way and try to make the best decisions that we can moving forward. Recognizing that the goal ultimately is to break the chain of transmission from young person to their mom or dad, and from their mom or dad to their grandmother or grandfather. And that's the struggle, is that we want to somehow effectuate a process so that young people don't transmit to older people, and then ultimately people who are particularly vulnerable.
Thank you. And the letter of instruction pushes up the deadline for vaccination, at least in Windsor, for our municipal facilities. And I guess it potentially means that some youth could get left out of sports temporarily. I'm wondering why it was important to set a deadline that took effect ahead of other deadlines, particularly in Windsor.
Well, the burden of COVID-19 in Windsor-Essex has been significant. It has the 4th highest case rate in the province, has the 3rd highest percentage of young people, or percentage of people testing positive on the test. So I think that the first issue is the burden of COVID-19 in Windsor-Essex is greater than it is in almost all other health districts. The second is, historically, Windsor-Essex has suffered disproportionately from the burden of COVID-19 as a community. It had additional school closures, is my recollection, where schools were closed in Windsor-Essex when they earlier than other school districts, and Nicole can correct me on that. Windsor-Essex had longer periods of lockdowns. So there's historical precedent in Windsor-Essex as well. Thirdly, vaccine has been available for people 12 and above since May of 2021. So the opportunity to be vaccinated has been present for many months for young people during this pandemic and all throughout the summer. Fourthly, getting vaccinated, the goal, and this is, I think, is a really important point, the goal is to prevent transmission of COVID-19 at recreational facilities. This is both a practical and we have historical precedent. So as a practical matter, when people engage in certain recreational activities, especially ones that have particularly vigorous exercise, it's a very high risk activity for transmission. People are playing hockey or they're playing basketball, they're not wearing masks. They're in close quarters with each other. They're engaged in vigorous respiratory activities and breathing. That can all transmit COVID-19. Secondly, we want to try to prevent outbreaks related to athletic facilities. So we know that people that are unvaccinated are at a higher risk for getting COVID and at a higher risk of transmitting COVID to other people. And so if we have a community of people and that are unvaccinated, they're at higher risk for transmitting COVID to the community of people that are vaccinated. So we want to prevent outbreaks at recreational facilities. In the previous year, in recent times, we've had outbreaks related to athletic facilities, and we had one cluster outbreak that ultimately spread to multiple recreational facilities and spread to schools. And so there's already precedent in Windsor-Essex for how introduction of COVID-19 into recreational facilities can spread to other recreational facilities and to schools, and then ultimately to families. And I think in this one outbreak, more than 24 families were also affected. So when we think of it collectively, I think that this is the right public health direction or the right public health policy to try to effectuate containment. Recognizing also that if you get vaccinated today, it'll be 3 more weeks before you get your second vaccination, and then it'll be 2 weeks before you have peak benefit. So we can't wait till the middle of November in the context of the public health emergency for people to get vaccinated if they want to participate in recreational activities at these facilities. Again, my colleagues, I'm sorry for being long-winded on this, but I hope that provides context.
Thank you very much.
Do we have any additional questions from Blackburn?
Nope, asked and answered. Thank you.
Additional questions from Windsor Star?
No, thank you.
Any further questions from AM 800?
Sorry, I just have one, Doctor. I'm not even sure if you can answer this, but earlier when you were talking about the number of cases associated with restaurants prior to the letter of instruction and after the letter of instruction, do you know if those individuals were vaccinated or not?
I don't have that data element in front of me. Maybe Nicole can comment.
Yeah, we can tell you that majority of our cases were associated with many of the outbreaks were, I won't say unvaccinated, but not fully vaccinated. So
thank you.
That answers your question.
Thanks, Nicole.
Any additional questions from CTV?
No, thank you.
Any further questions from CBC?
No, thank you.
All right. Thank you very much, everybody. Have a wonderful Wednesday.
Great. Thanks so much. All the best.
Thank you.
Thank you.